Hi, I'm here to talk to you this day about tuberculosis. Today is 24th of March and it's the World TB Day. And I don't know how much you know about tuberculosis, but I'll talk to you about TB. Now, TB or tuberculosis is a disease caused by a bacterium um, called Mycobacterium tuberculosis. And this bacteria usually attacks the lungs of individuals, but can attack other parts of the body like the brain, the spine, even the kidneys can be attacked by the bacterial organism. And when these lungs are infected or attacked, it can spread from person to person. It usually spread through the air from one person to another if there's a close contact and one who is infected coughs can, or sneezes or talks close to someone who is uninfected. The uninfected person can inhale, can breathe in the organisms in the air or the droplets there and then can get infected. And usually it's the family members, friends, bedmates, roommates, schoolmates, co-workers of the infected person that can get infected by inhaling these droplets. Even health workers too can get infected. Um, Sometimes we get infected, but we do not have the disease. There's a difference between being infected and having the disease. Infection can be there, but the body has mechanisms that take care of the bacterial organism so one doesn't come down with symptoms. But if the immune system is weak, then one can come down with these symptoms, and then you can say the person can be said to have had the disease. And most times the things that affect the immune system include HIV. HIV and TB, there's an alliance between the two of them. There's what we call HIV TB co-infection because those who are HIV positive, immune system drops and then they can now get infected by the tuberculosis and then can progress to getting the TB disease. Others include those who are on cancer medication or who have cancers, who are on steroids, who are on immunosuppressive drugs that bring down the immune system, those who are diabetic as well, or even those who have been treated for tuberculosis before. Now, what symptoms do TB patients have? There's cough, a chronic cough that has lasted for up to 3 weeks. The cough may be productive of blood. You could have blood coming out of the cough, or when you cough out sputum. And then other things include fever, maybe weight loss I would call unintentional weight loss. There could be night sweats, or to say drenching night sweats. Um, Chest pain could also be there. These are symptoms of tuberculosis. Now, what do you do if you have these symptoms? You report to a health center, to a hospital, to a clinic. If you have had contact with anybody who has TB or who is suspected to have had TB or to have TB, or you have any of the above symptoms I've mentioned, or you have HIV or any other disease that brings down the immune system, then you should get yourself checked for tuberculosis. And the tests that we do include a skin test, what we call a mantle test, there's chest X-ray. We could even do a CT scan, but here in Nigeria, most times we do a skin test, a mantle test, we do a chest X-ray, and we could do a sputum examination, where the things that you cough out can be taken to the lab to test to see if the organism itself is found in your sputum. Now, treatment includes treatment can the disease can be cured. Tuberculosis is a curable disease and can be cured after 6 months. After taking medications for 6 months, there are basically four main drugs I would give. These days, it's actually combined as a fixed drug combination. So just a drug you take every day. You must be taken every single day for a period of 6 months. During the treatment, regular tests will be done to monitor the organism in the sputum. And there are side effects of these drugs. Your doctor will tell you about if you're going to take these drugs. And these drugs must be taken as specified. You must take them as specified. And drugs must not be stopped. I repeat, must never be stopped until it is completed. Because if it is stopped, there's a chance I can develop resistance, which is a different thing, and treatment is a different treatment altogether, which is more cumbersome than the general treatment for the primary tuberculosis. And most times after taking or during the drug treatment, after 2 to 3 weeks, you may feel better, but that's not a good reason to stop taking the drugs. You must take them completely for 6 months, even when you feel well. And after 2 to 3 weeks, the person may not be effective again. The chances of transmitting the disease to another person may reduce after 2 to 3 weeks, but continue taking the medications. And today, like I said at the beginning, is World TB Day. That's 24th of March. Every year is celebrated as World Tuberculosis Day. And this year, 2016, the theme is Let's Unite to End TB. And there's a strategy that has been ongoing since 2014, which is which has a vision. It's called the NTB strategy. It has a vision of a world free of tuberculosis, where there will be no deaths, no disease of TB, and no suffering due to tuberculosis. And all these things can be achieved by 2030, I believe so. And how can we prevent ourselves? Prevention, primary prevention can be done by vaccinating all babies at birth. It's done in Nigeria here. We have the BCG vaccine given to all babies born, and then avoid overcrowding, have a good cough etiquette, cough into a disposable napkin or your handkerchief that you wash and cough into your sleeves and not into the open air to reduce transmission of tuberculosis. And health education, like I'm giving to you now, health promotion, these are measures that can be taken to reduce tuberculosis. Present early if you have symptoms of TB, so a doctor can check you and then begin to receive treatment quickly, promptly as possible, so you avoid worsening the disease. And treatment must be completed, must be taken adequately to prevent development of resistant TB. Ensure your children get vaccinated at birth. Know how TB is transmitted, like I'm informing you today, so you should know how it is transmitted. And then HIV reduction, or reduction of transmission of HIV, is also a good measure to preventing TB. And together we can end tuberculosis by 2030. Today is World TB Day. Thank you.